joined today by Shane Ryan, CEO of BCAL Diagnostics. Shane, thanks for your time.
Thanks, David.
For those who don't know BCAL, can you give us the helicopter story of who's the company and why is it so compelling?
Yeah, thanks. Well, it's 14 years in the making, and over that time, our fantastic team has developed a blood test for the early detection of breast cancer. So that means that a woman will be able to go and have a blood test taken at a pathology lab somewhere, send the test to us, be analysed, and we'll be able to detect whether that sample has cancer tissue in it or not.
How important is it from a team perspective to be developing a technology that is so important for women's lives?
Oh, it's fascinating. It's so rewarding. I've been involved in healthcare for nearly 40 years. There's been a lot of great progress over that time, and we're really on the cusp of taking this test to market, which will truly transform the way we screen and look for breast cancer for women.
What have been some of the milestones over the last 6 to 12 months that have excited you most about the advancement of this technology?
Oh, look, the science is the centre post for our program, and it's really just been so robust. The results have been phenomenal. We're on the cusp of just another 2 studies now, which will be the final ones before we go to market. But pleasingly, we've brought a great team together, and this whole year and the next 12 months ahead is about execution. And I'm just so proud of the way that the team's pulled together. Very purpose-driven organisation. I mean, what a great thing to be able to truly change the outcomes for women with breast cancer. It's just a great time for the company.
And where to from here? As you say, a big year coming up. What should investors be focusing on?
Yeah, so there's some key issues ahead of us, all very solvable, all very methodical in the way that we'll approach that. But of course, we're looking for accreditation of our laboratory here in North Ryde, and that'll be conducted through NATA, which is the governing body for accreditation of laboratories. So that'll be happening later this year. There's a lot of preparation required for that, but we're in a great place to get a successful outcome there. And of course, we're just about to do the largest cohort of Australian women study. We should have the results of that in the near future. And then we're running a clinical validation study. And what does that mean? That's really looking at our test and its performance in the real world setting of breast screening. So we'll be doing that in conjunction with Breast Screen Australia, a number of sites across both New South Wales, Victoria and the ACT, which is very exciting.
And how closely does Big Pharma watch what you're doing and watch the results as they start to come out?
So look, I suppose Big Pharma is really interested in the therapeutic side of biomarkers, and there's been a lot of investment and a lot of progress in that, certainly over the last decade. Not so much in the area where we're focusing, so we're really focusing on screening and the early detection of cancer. And so, of course, it'll be interesting to pharma, but they're more focused on the therapeutic side at this point.
So why are biomarkers so important for breast cancer?
Oh, it's a great question. To be honest, there hasn't been a ready access to biomarkers, modern biomarkers in the breast cancer space, certainly from a screening perspective. Accessibility into Australian women, it's been cost prohibitive. A lot of the tests are only available in the US and in Europe, but we're hoping to really change the game in that space, make it very affordable from a patient's perspective, and great access developed and turned around here in the Australian market. So men have had access to tests like PSA for many decades, but of course there's been nothing for women. And so we're hoping to really introduce this test and improve the outcomes for women, complement the work that's already being done by our great Breast Screening Australia program, and really take it to a new level and modernise the personalised screening program that could be in place for women.
A quality team, a clear focus, an addressable market that is really important to a lot of us and a problem we really want to solve.
Yeah.
Exciting times ahead for BCAL Diagnostics and its shareholders. Shane, thanks for your time.
Thanks very much, Dave.